Welcome everybody to today's webinar on International Clinical Fellowships at the Royal College of Physicians. We're really pleased that you've been able to join us this morning, and we're going to take you through some information, and we will also have a panel discussion at the end. We're going to record this session just to make everybody aware. You'll have the option to put some questions to the panel or to any of the speakers in the chat function. If we don't get to your question today, we will ensure that all questions are responded to and all participants will receive the recording and answers to your questions. Okay, thank you very much. Anton, can you set up the first slide, please? So as I mentioned, today we're discussing International Clinical Fellowship opportunities at the Royal College of Physicians of Ireland. Next slide, please. So just to take you through the webinar, I'll give some brief introductions to the team who look after global training and partnerships and the Clinical Fellowship Programme at the Royal College of Physicians, tell you a little bit about the college in Ireland, and then I'll hand over to my colleague, Mr. Adam Lecumber, who will take you through the actual fellowship programmes, and Paula Kavanagh will take you through the actual recruitment process. Then back to Adam for the onboarding process, and our partners, Castell Education, Ms. Denise Healy, will provide some information. And then Zoe Edwards, who is our manager in the Education and Training Delivery team, will discuss training and what to expect as you train here in Ireland. And then finally, our senior manager, Ms. Sinead Freeman, will host a panel discussion on the International Clinical Fellowship Programme. Thank you. Next slide, please, Anne. So the team based at the Royal College of Physicians of Ireland. I'm Sinead Lucy. I'm the Director of Business Development and Examinations. Sinead Freeman leads out the team. She's our Senior Manager in Examinations and Global Training and Partnerships. Paula Kavanagh, Global Training and Partnerships Manager. Mr. Anton Bablumbliak, who's our Global Training and Partnerships Coordinator. And Mr. Adam Lecumber, who's our Development Executive. Next slide, please. So just to take you through our mission, vision and values. So we have a long history of training international doctors, and it's very much aligned to the mission of empowering and developing and supporting our community of learners, trainees, members and fellows to improve health through training, education and advocacy. And this fellowship programme very much aligns and is our mission is central to this programme. We strive to create a global community of doctors engaged and enabled to improve health. And upon completion of your International Clinical Fellowship Programme, you become part of a community of doctors who will continue to support, network, partner with you as you drive on with your medical career. And then just to highlight, our values are very much centred around welcoming, trustworthy, respectful, responsive, connecting and challenging. Next slide, please. Ireland, you may or may not know about Ireland. Some of you may have visited us, but we are located on the very western tip of Europe. We're very well connected to the UK, Europe, North America and the Middle East. We have a mild climate with an average temperature of 10 degrees. So you'll see the umbrella icon. I would certainly advise bringing an umbrella and a good raincoat, but very, very nice temperature in the summers as well. It's about 20 degrees. English is the spoken language, and it's a very friendly and safe place to live. We consistently rank very high on the Global Peace Index, and in 2025 we were ranked second. Home to 5 million people, and again, internationally, Ireland is internationally recognised for excellence in not just post-medical training, but also education and training across all levels. But obviously today we're very much focused on postgraduate medical training. Thank you. Next slide, please, Anton. So we're just going to play a video for you now, just to give you a flavour of what Ireland looks like. It's music, it's people, it's landscape. So please enjoy. Okay, so I hope you enjoyed that video. I'm now going to hand you over to my colleague, Adam Lacumber, who's our development executive on the team, and he's going to take you through some of the specifics of the International Clinical Fellowship Programme. Thank you.
Thanks, Sinead. Hi, everyone. I hope you're all doing well. Thank you very much for joining us today. So my name is Adam. I'm the Development Executive within the RCPI Global Training and Partnerships team. So our clinical fellowship programs offer clinical training to international doctors who are sponsored by their government, hospital, or national training body. Our programs provide a unique opportunity to develop professionally as a doctor and learn advanced skills that will be beneficial for the health services in your home countries. So on the next slide, I will talk more about our programs. So we offer a wide range of specialties across our 6 faculties and institutes. So as you can see here, we have the Institute of Medicine, Faculty of Pediatrics, Institute of Obstetrics and Gynecology, Faculty of Pathology, Faculty of Public Health Medicine, and the Faculty of Occupational Medicine. The duration of our programs is typically between 2 to 3 years. However, this will vary depending on the specialty in question. For further information on each specialty, please scan the QR code on the screen to visit our e-brochure. So we'll reshare the QR code at the end of the presentation as well. So on the next slide, I will outline some highlights of our programs. So our programs are fully accredited with overseas health authorities, providing hands-on clinical experience with subspecialty exposure, with rotations across Irish hospitals within your chosen specialty under direct supervision by RCPI certified trainers within a multidisciplinary clinical team, focusing on outcome-based structured curriculum via e-portfolio, which includes annual evaluation of your training progress, study days and complementary courses, and also research and audit involvement. On the next slide, regarding clinical and academic supports, each specialty is led by an international clinical lead or national specialty director. So some of whom, fortunately, are on the call with us today. So the international clinical lead or NSD are responsible for designing the program curriculum, selecting trainees for the program, assisting in their induction, and annually assessing their progress, while also providing support to trainees and their trainers. So we also have RCPI certified trainers who help new trainees adjust to the Irish healthcare system, works with trainees to meet their training goals as per the curriculum, and signs off on end-of-year evaluations. On the next slide, you can see our range of relocation and program supports, which are free of charge for those who have been accepted onto one of our programs. So these supports at a glance include English language tutoring, namely IELTS OET via Castell Education, relocation support via Castell Education, a dedicated program coordinator and program management team, a dedicated international clinical lead or NSD for each specialty and overall associate director for the program, as well, of course, the RCPI Health and Wellbeing Department. So moving on to the next slide, I will outline the entry requirements for our programs. So firstly, in order to apply, applicants must be a citizen of Saudi Arabia, Oman, UAE, Kuwait, Qatar, or Bahrain. Must also hold a primary medical degree completed through English, have completed a structured internship, have completed residency training and incorporated exams, have a minimum of 1 year's experience post-residency training in your chosen specialty, and also be eligible for registration on the supervised division with the Irish Medical Council. Additionally, for Omani candidates must meet a minimum English language requirement at the time of application. So that's the OET minimum of 2 Bs and 2 C pluses taken within the last year, or an IELTS with an overall score of 6.5. To start in post then, you must have an IELTS of 7 with a score of 6.5 in all domains, or an OET with a score of B in all 4 domains. Also, you must have confirmed sponsorship with a government body with whom RCPI has an MOU. So there are also specialty-specific entry requirements, which you can see on this slide. So these include geriatric medicine, in which case the MRCPI or MRCP UK completion prior to applying, palliative medicine, 12 months of acute unselected take in required specialties prior to applying, histopathology, FRCPAT Part 1 completion prior to the program start date. And last but not least, occupational medicine, the LFOM exam completion prior to program start. So next, we're going to watch a short video which highlights a day in the life of one of our current international trainees, Dr. Talal.
Good morning, I am Dr. Tal Zahrani. Welcome to a typical day of my life here in Ireland.
It's an early start for Dr. Talal as he prepares for a busy day at Children's Health Ireland. A short walk from his new home, he begins his day with a sense of purpose and dedication to patient care. Dr. Talal makes his way through the vibrant city of Dublin, the capital of Ireland. Dublin is a safe and friendly city with lots to see and do. At Children's Health Ireland, Dr. Talal is part of a supportive environment where collaboration and teamwork are at the heart of patient care. After a busy morning with patients, Talal meets with his trainer, Professor Des Cox, and other consultants, who ensure he gains experience and exposure to a range of medical cases. Beyond the hospital walls, Talal enjoys moments of respite, savouring the rich culture and making friends in his new home. A day in the life of an international fellow is a tapestry woven with dedication, compassion, and a commitment to making a difference. Dr. Talal is working toward a brighter, healthier future, gaining important experience and skills to bring back to his home country.
Good afternoon, everyone, and thank you for your time here today. My name is Paula Kavanagh, and I am the Global Training and Partnership Manager here in RCPI. Today, I'll be talking you through the RCPI recruitment process and for the International Clinical Fellowship Programme. So the purpose of this overview is to give you a clear understanding of how the recruitment process works from start to finish and to highlight the key stages involved, including timelines, assessment points, and decision-making milestones. Next slide, please. So what are the recruitment stages? Recruitment begins in April, which is when applications open. At this stage, candidates submit their application in line with the published eligibility criteria, programme entry requirements, and the required supporting documentation. During this period, we also focus on providing guidance and clarity to ensure candidates understand the requirements and expectations of the programme. The next phase takes place in June and July. Once applications close, RCPI undertakes a structured eligibility verification and application review process. This includes verification of documentation, assessments against the published eligibility and programme criteria, and the shortlisting of candidates in line with the specialty-specific requirements and available training posts. The final stage then takes place in September. Shortlisted candidates are invited to attend an in-person interview, which is conducted with the relevant key stakeholders. Following the interview process, outcomes are communicated and the onboarding and pre-arrival process begins for the successful candidates in preparation for their entry into the programme. Overall, this phased approach ensures a fair, transparent, and robust recruitment and selection process, fully aligned with RCPI governance, quality standards, and programme requirements. With that in mind, I'd now like to show you a short video that walks you through the structure of the application process and provides a helpful visual overview of the journey from application to acceptance.
The process of joining one of RCPI's prestigious international programs couldn't be easier. When you're ready to apply for one of our residency or fellowship programs, you can start your application online and through our website. For residency, you need to have completed your degree through English, completed or be near completing a structured internship. For fellowship, you need to have completed a primary medical degree through English, completed a structured internship, completed a national residency program, and passed the associated final board examination. For both residency and fellowship programs, you will require provisional sponsorship from a government body we have an agreement with. Remember, you don't need to have an English language certification or MRCPI to apply for either program. Make sure to submit all required documents correctly. And if you have any queries, just reach out to the RCPI team and we'll be happy to help. If your application is shortlisted, you'll be invited for an interview in one of the Gulf Cooperation Council countries. Successful candidates receive an offer within a few days. Officially accept your offer by email. The RCPI team, along with Castell Education, will support you right through onboarding into the program and training itself. If you need to meet English language proficiency requirements, we offer one-on-one tutoring to prepare for the OET or IELTS examinations. For those joining the residency program, RCPI tutors will provide tutoring and access to a question database for the MRCPI Part 1 examination. RCPI and Castell Education will help you register with the Irish Medical Council, visa applications, and finding accommodations, schools, and childcare. We even assist with everyday tasks like opening a bank account. You will arrive in Ireland 2 weeks before your start date to settle in your new home, attend an induction day, and then begin your journey to advance your medical career in one of our Irish hospitals. Graduates from the Royal College of Physicians International Residency Training Program and International Clinical Fellowship Program have gone on to achieve the following roles and advancements in their careers. Apply to an international program with RCPI today.
Thank you for your time. I'll now hand over to my colleague Adam, who will talk you through the onboarding process.
Hi again, thanks Paula. So I'll now walk you through a very simplified outline of the onboarding process. So within the Global Training and Partnerships team, we have a dedicated international admissions coordinator to help you progress through the onboarding process. So as you can see here, the first stage of the process is the one-to-one onboarding meeting, which really is an opportunity for our international admissions coordinator to introduce themselves to our candidates. And this meeting also gives our candidates an opportunity to ask any questions they might have as they embark on their training journey with RCPI. We then refer you to our brilliant colleagues in Castell Education for either English language tuition or relocation services, who we'll hear from shortly. The next step is then to liaise with the clinical lead for each program, who will confirm your year one clinical placement or hospital allocation. So this is confirmed well in advance of your program start date to give you enough time to secure accommodation in your allocated training centre. Once each of the above steps have been complete, we can then apply for your work permit under the atypical working scheme, which is needed in order for you to take up post in Ireland. RCPI will apply for this on your behalf. So coming towards the end of the process, Castell will then assist you with your entry visa, while also advising you with regards to your travel plans from the Middle East to Ireland. Provided the candidate successfully moves through the onboarding process and has arrived in Ireland, you will then hand it over to my colleagues in the international delivery team, who will support you for the duration of your training program in Ireland. Lastly, you will attend our induction, which will take place in Dublin, and is a great opportunity to meet fellow international trainees and to link in with RCPI staff in advance of commencing your training program with us. So thanks very much for your time. I'll now hand you over to Denise from Castell Education.
Yeah, good afternoon, everybody. Can you see my slides okay on your side, Adam?
Not yet.
Not for me, I can't.
I actually can't replace the slides on the screen, so maybe Anton could share the slides. I don't have the rights.
Okay.
Oh, I'll try again.
There you go.
That's it.
Perfect. Good afternoon, everybody. This session will focus on the English language tuition that we provide and the relocation services that we have provided to RCPI doctors for the last 10 years. This is a complementary service provided by RCPI to all their doctors transitioning to Ireland. So this session will focus on the English language tuition that we provide and the requirements for registering with the Medical Council of Ireland. I'll give you an overview of the complete doctor journey with Castell that includes pre-arrival and in-country supports. So in terms of English language, so the two exams that are accepted by the Medical Council of Ireland, and Adam mentioned this in his previous slides, is the academic IELTS or the OET. They're equally challenging exams, very different. So for the International English Language Testing System, a doctor is required to have an overall 7 with no skill less than 6.5. Or
sorry, excuse me, Sinead, Lucy here. I just see your slides aren't moving. They just might have an issue. Do you need to go into slideshow? Oh, have we lost Denise?
no, I am here, but my screen seems to be frozen. Maybe if
no problem. Just give us, just to the audience, we'll just sort out our slides. If you just give us a couple of minutes. Anton, it's probably best if you share Denise's slides, if that's okay. Or not?
Did I try again?
No, you started it. Yeah, I think that's probably
many
better.
thanks.
Thank you so much, Denise. Apologies for the delay.
No problem, and apologies on my side. So if we move to slide 3, Anton. So as I was saying, it's either IELTS or OET, but we can work with the doctor on their preference. IELTS is an academic exam and OET is very much focused on medical terminology. From our experience, doctors choose OET more than IELTS. It's becoming more popular. So the Medical Council accepts the following type of exam. So if you're thinking about going to pursue an English exam, just be aware that you will have to go to an official exam centre to take either a paper-based or computer-based IELTS or OET. So the Medical Council, unfortunately, doesn't accept OET at home. There is an option to choose to take OET or IELTS at home, but the Medical Council don't accept it, or they don't accept a one-skill retake. So many doctors find themselves in a situation where they have a deficit in one skill, be it listening, reading, writing, or speaking, but they are required to take the 4 skills in one sitting. So just be mindful of the type of exams that are accepted by the Medical Council and the mode. Okay, so I might move to the next slide, please. So just a typical English language journey with Castell. And if you do accept your offer with RCPI, I would strongly encourage that you do engage with the English language tuition that is provided. So all doctors are required to reach a proficient level of English to be able to cope in an and work in an English speaking environment such as Ireland. So RCPI refer a doctor to us and we give an overview of the English language service. A doctor's exam preference is decided, and then they're introduced to an expert English language tutor who will work with them around their busy schedule to organise one-to-one tailored language support. We do a diagnostic assessment with each doctor to identify any linguistic gaps, and then we monitor progress, and we provide a writing correction service, speaking, one-to-one practice, and lots of extensive practice tests. We also report engagement to RCPI on a fortnightly basis, and then when the doctor is ready, they go and sit their exam, either IELTS or OET. If they meet the requirement, then they continue with our team on their medical council registration and all of the other relocation supports provided. If they don't meet their requirement, we continue to provide tuition until they're ready to sit their next exam. So that's just an overview of the language tuition that's provided to each doctor. So I'll move to the next slide, Anton, please. So just in terms of the steps that we provide support on. So the first step after you accept your place is you think about your IELTS or OET, and then when you have that met, you can move to your medical council registration, and this can take up to 8 weeks. It's a very detailed process, and we provide a step-by-step guide on what documentation is required to get through that process. Then we provide immigration supports to you and your family if they're traveling with you, and we give you lots of visa advice. And then prior to arrival, we determine what type of accommodation is most suitable for you and your family. And we provide all of the information that you will need for temporary permanent accommodation when in Ireland. And many doctors travel to Ireland with their family and with children, and in those cases they require supports with creches, childcare and schooling, and all of that is determined prior to arrival and at arrival stage. When you arrive in Ireland, we provide a pickup service, a chauffeur from the airport to transport you to your accommodation, and then we provide ongoing settling in support on a daily basis when you're in Ireland. So that's a typical journey with Castell when you arrive in Ireland. As Adam mentioned, it is a free complimentary service to all doctors, and it really takes the stress of transitioning to a new country that you're not familiar with, so you can just focus on taking up your post in your hospital and leaving all of the stressful processes to us to take care of. Okay, I'll move to the next slide. I won't go through this in detail, but in terms of the medical council registration, we do provide a step-by-step assistance to you in terms of all of the supporting documents that you need. So that is there, and immigration services in terms of family and personal visa applications are there. When you are in Ireland, you may want to travel outside to attend conferences. And again, we provide advice on third country visas if required. Okay, so I will move to the next slide. And in terms of accommodation, when you arrive in Ireland, we organise the viewings of the accommodations that you choose. And we also have a team to review the leases of the accommodation before you sign, so that we ensure everything is in order for you and you can settle in smoothly. Schooling and childcare support is provided if required, so I won't go through those individually. So I'll move to the next slide now, Anton. And when you arrive in Ireland, each doctor will be provided with a personal welcome information pack that is tailored to you and your post in your hospital, and it will provide all of the settling in advice that you require whilst in Ireland in terms of your local banks, setting up utility bills in your household, health insurance, mobile phones, PPS numbers. So all of the information is in a welcome pack tailored to your needs. And we have a team in place to provide ongoing daily supports to you while you settle in Ireland. So that is it from me. And the last slide has a summary of the supports provided, and that is my email address if you require any assistance with English language, choosing particular exams, or medical counsel and relocation supports. That is my colleague's email. So I will be here at the end to answer any of your questions you may have. So I will hand you back to the panel now. Thank you very much for your time.
Thank you, Denise. That was really informative, as always, and a lot of rich knowledge for trainees thinking about coming to Ireland. And the college really does appreciate the support that we work in partnership to deliver to trainees. So thank you again. So next up on the agenda, I think we're handing over to Zoe Edwards, who's going to talk a little bit about training. Thank you.
Great, thanks Sinead. Thanks Anton for sharing the slides. So we're nice and brief on this side with one slide, but you would have heard a lot of information, I suppose, about the onboarding process and applying for the fellowship program and all the great supports that Castell provide as well. So from our perspective, my name is Zoe Edwards. I'm the Education and Training Delivery Manager in the Royal College of Physicians. And at the point that myself and my two colleagues who are mentioned there, Mappy and Rosie, will be dealing with yourselves would be when you've actually come to Ireland and you've started on your programme. So we're the delivery support team. So we will provide supports for general programme queries that you have while you're ongoing on the programme. We provide support to the various systems that you'll use. So you'll use an e-portfolio system where you're logging all of your clinical experience and your educational experience. So we'll provide support for that. We've also set up a new international hub this year. So this is a virtual learning environment site where you have access to various different resources. We have different policies, procedures, your handbook there as well. And there's some interesting modules about adapting to the Irish healthcare system as well. We also provide support, giving you access to study days and different educational programs that are going on in the college. So we'll support you in getting access to those. And then we'll also facilitate the annual evaluations where you'll sit with your clinical lead to be evaluated on your progress for the year and where they provide feedback. So we'll facilitate and sit in those meetings. Aside from that, on the day-to-day, we'll signpost you to the various college supports like wellbeing, the curriculum team. If you have any queries around exams, we'll be your kind of first port of call for support with those. We'll also attend check-in meetings with yourself if you need any support. So they're the kind of day-to-day, and if you have any like letter requests or anything like that, we can provide advice on visa extensions and different aspects of the programme as well. There's a little QR code there as well. If you would like to scan that, that's just access to our current training handbook. We have an e-copy of it as well, and any trainees who come onto the programme will receive a copy of that printed as well when they come to their induction. That kind of lays the programme out start to finish and the different contacts as well. So it's a really useful resource. And yeah, happy to answer any questions in the Q&A that's available there if there's any questions on the kind of day-to-day delivery of the programme. Thanks, Sinead.
Many thanks, Zoe, for taking the time to be with us this morning. And yes, that's a great resource, the Scan Me QR code. So please use that. It'll give you lots of really quality, informative information. So we're kind of coming to the final session now, where we will my colleague Sinead Freeman will host a panel discussion with our clinical leads, and this is a really valuable opportunity for you to ask questions and to listen to what our clinical leads, who are training international trainees and national trainees on a daily basis. So thank you for that. Sinead, I'll let you take over as host.
Sure. Thank you, Sinead. Good afternoon, everyone. As Sinead said, my name is Sinead Freeman, and I'm the Senior Manager for Exams, Global Training and Partnerships here in RCPI. And I'm very pleased to facilitate today's panel discussion. I hope everybody found the presentation earlier really helpful. And what I will now ask the panel is just a number of trainee-focused questions.
And I suppose the aim of this really is to give you a better understanding and insight into our international clinical fellowship programs, and to provide you with some actionable takeaways from this afternoon's session. And as mentioned before, during this panel discussion, there will also be an opportunity to, we'll try and answer as many questions as we can in the Q&A chat box. So I'll just introduce you now to the panel. We have Prof. Cecily Quinn. She is the International Clinical Director for all our programs. She wears two hats, and she's also the International Clinical Lead for Histopathology. We also have Prof. Basil El-Nazir, who is the International Clinical Lead for Pediatrics. Dr. Suzanne O'Sullivan, who is the International Clinical Lead for Obstetrics and Gynecology. And you have met already Denise Healy, who is the Centre Director of Castell. And then finally, Sinead Lucy, who is the Director of Business Development and Exams in RCPI. So I'll start off with the first question then to Prof. Quinn. If you could just give an overview of like what a typical day for a histopathology resident involves. Sorry, Prof. Quinn, I think you just unmute there.
Sorry, did you want me to address the residents or the fellows? Which are
the fellows.
Yes, the fellows. Yeah. Okay. So for the fellows, well, thank you very much. Very nice to meet all of you, and thank you for attending. So the questions that we had kind of selected for the fellows were the diagnostic responsibilities that the fellows were expected to undertake. So we expect our fellows to participate fully in the delivery of the diagnostic clinical service in histopathology. Now, in our training program for our own trainees and for the fellows who come from abroad, this takes place very much under consultant supervision, and the degree of supervision will vary depending on the level of experience of the individual fellow. So the duties involve a number of different aspects. First of all, we have specimen dissection, and this involves examining gross specimens, for example, a colon, a liver, a breast, a kidney, dissecting that thoroughly, taking account of the clinical and the imaging findings, taking the appropriate blocks for microscopic evaluation, and constructing a macroscopic description, which will form part of the final report. So then, usually on the following day, or maybe within 2 days at the latest, you receive the slides from those blocks, and then we expect our fellow to screen those in detail and to recommend ancillary studies such as immunohistochemistry, and to formulate a report, and then that is all reviewed by the consultant in consultation with the fellow, and a final report issued. So that means that the fellow is involved in the diagnostic process really from the beginning until the generation of a final report. In addition, then our fellows would see a lot of biopsy specimens, small specimens, again, breast, GI, skin, etc. So they'll get experience in reporting biopsy specimens in addition to large specimens. We also expect our fellows, as part of their attachment to the individual specialties, to attend multidisciplinary team meetings, to present their findings, to interact with the clinical staff, and to put all of the information in context. I mean, today medicine is very much multidisciplinary, and pathology is one part really of a much larger team. And we also expect our fellows, if they are quite senior, to help to supervise junior trainees, which is useful for both the junior trainees, but also for the fellows in preparation for taking up a consultant post later on. So the duties really are the same regardless of the stage of training, but the degree of responsibility varies significantly depending on the stage of training. So I think that really is that area, Sinead, in terms of the duties, and the day then is organised around that.
Perfect. Thank you, Prof. Quinn, for that. The next question then is for Prof. El-Nazir. What age groups, paediatric subspecialties, and complexity level are fellows most exposed to during the programme? Yeah. Prof. El-Nazir, if you're there, or Prof, are you muted? We just can't hear you.
Maybe move on just while we sort out the...
Okay, sorry about that. So we'll just move on to Dr. O'Sullivan then. If you could just let the audience know, how is the clinical time balanced between obstetrics and gynecology during the fellowship program?
Thank you, Sinead, and lovely to meet you all and speak to you all. I suppose in obstetrics and gynecology, we currently have 5 different fellowships. So we have a fellowship in labour ward leadership, in maternal medicine, in advanced gynecological surgery, in urogynecology, and in reproductive medicine and IVF. And we're looking at launching a fetal medicine program as well this year. So each fellowship will stay within their obstetric or gynecological subspecialty. There is an element of on-call where you'll obviously be covering both obstetrics and gynecology, but that on-call should not interfere with your exposure to your subspecialty or your specialist areas. So we would be, obviously, depending on the fellowship, be looking at clinics. Generally, that goes across obstetrics and gynecology, and they could be general and subspecialty clinics. For the gynecology rotations, you'll have theatre lists with management of the theatre lists and pre and post-op ward rounds. There'll be ward rounds with maternal medicine and, with all of the specialties. Fetal medicine and maternal medicine will be more associated with scanning sessions, exposure to intensive care, and into combined clinics where we have cross-specialty clinics with physicians looking at neurology, epilepsy, gastroenterology, rheumatological conditions, and all of the other medical complications that can occur in pregnancy. So it's really specialty specific and with adequate but very varied and broad exposure to each area of the fellowship.
Thank you, Dr. O'Sullivan. Prof. Al-Nazir, are we...
Can you hear me now?
Yes, we can.
Perfect. Well,
thank you.
Sinead, and apologies, and thank you for the attendees for attending this session. So your question was the range of pediatric patients that we are exposed to. So as you know, pediatrics start from newborn babies until 16 years of age. So the range that we deal with is from 0 to 16. So depending on the subspecialty chosen, people will have the opportunity to be exposed to neonatal medicine from birth onwards. We have the full kind of length and breadth of pediatric subspecialties, including allergy, clinical genetics, endocrinology, respiratory, rheumatology, hematology, oncology. So all the subspecialties. And within that subspecialties, all the different age groups are represented. So you might have a newborn baby with some issues, or you might have a 16-year-old child with these issues. So the program offers the full length and breadth of the pediatric subspecialties.
Great, thank you so much. So I'll just go back to Prof. Quinn then for the next question. How much hands-on experience, exposure will a trainee have to specimen analysis? You're just on mute.
Yeah, I got it, yeah. So there's 2 issues, I guess. Is the exposure in general. Well, as I said earlier, we expect our fellows to take a full part in the clinical diagnostic service. So we have 2 types of fellowship in histopathology. First of all, we've got the clinical fellowship. And generally speaking, clinical fellows are fellows who've carried out quite a lot of their training in their home country. They've passed their Part 1 FRC path, and they come to Ireland for 1 or 2 years to complete their training and to complete their final exam, the FRC path Part 2. So in the course of their training, they will rotate through all of the various subspecialties and get a broad overview of all of histopathology. They'll also have experience in cytopathology. If trainees wish to undertake autopsy pathology, that's clearly optional, but there is also opportunity to do that. And there's also dedicated preparatory sessions for the final exam, which takes place at the end of training. And that training takes place both within the departments on a rotational basis, but it also supplemented by formal teaching at RCPI. Now, we also have increasingly fellows coming to do subspecialty training, and we have subspecialty opportunities really in all areas of histopathology. We've had fellows do GU, GI, GYN, and soft tissue to date, but we also have opportunities in other specialties, including breast and ENT and a number of other subspecialties. So subspecialties, most of the teaching hospitals in Ireland now offer subspecialty service in histopathology. So trainees, if they are fellows, if they're coming to do subspecialty training, then they spend their time in that specialty and develop that then to a higher level, participate in the multidisciplinary meetings and focus exclusively on one specialty. So depending on whether you're doing clinical fellowship or subspecialty, the configuration of the post will vary, but all of it is focused on delivery of clinical service, then supplemented by research projects, audit projects, etc.
Thank you, Prof. Quinn. I'll just have to ask Dr. O'Sullivan then, just around how hands-on is the surgical and procedural experience for fellows in RCP or in ONG, sorry.
It's very hands-on. We're a very procedure-led and practical specialty. So in terms of gynecology, there will be weekly theatre lists with a broad variety of cases. Again, it's a benign advanced gynecology fellowship. But again, a lot of whilst things are very procedural, the importance and the holistic approach to patient management involves the organisation of theatre lists, the ward rounds before and afterwards, the consent process, the quality and safety around all procedures. So we really are looking at developing not just procedural skills, but clinical expertise, looking at guidelines, policies, protocols, collection of safety data and improving quality and patient safety across all levels. Maternal medicine would probably be less procedural and more knowledge based, but each fellowship will give the appropriate level of exposure to procedural and knowledge based advancement that is required from the curriculum.
Perfect, thank you. I'll just move on to Prof. Al-Nazir then. In your experience, how does the fellowship program prepare trainees for senior pediatric roles?
So the program is structured around two major aspects: the clinical, academic, and the leadership. Or three actually: clinical, academic, and leadership. So the clinical would ensure that the trainee is having complete supervision in all aspects, and depending on the level of expertise and the ongoing assessment, different assignments will be given to the trainee. The academic is covered by the obviously very clear mentoring and the courses that the college provides, including courses on leadership. Then during the trainee time in the program, there will be obviously the expectation and the fact that the trainee will be attending clinics, ward rounds, organizing lists, organizing rotation around the sleep laboratory, organizing the reporting of the sleep reports, etc. If you're doing respiratory medicine, if you're doing endocrinology, the different tests that are conducted. If you're doing general pediatrics, organizing the clinics, the post-call ward rounds. So every bit has its part assigned to it. Now, during the program, and depending and possibly towards the latter end of the program, these trainees will be allowed to lead on certain activities under very close mentorship, with the view that they will be able to lead later on an independent service. And we have very good examples of many of our trainees who now are leading services in their home countries. So they'll be offered the full support in all these three aspects: clinical, academic, and leadership domain.
Perfect, thank you, Prof. Al-Nazir. So my final question then for the clinicians is, I'll start with Prof. Quinn again. What types of biopsies or specimens will a fellow see?
Yeah, as outlined earlier, the clinical fellows are expected to participate fully in the diagnostic service, so they see the entire range of specimens represented in the department. So, for example, at St. Vincent's Hospital here, we have a very active breast unit, GI, dermatology, endocrinology, liver, whereas in St. James's Hospital, and often we have our fellows rotate between those two centres in St. James's, while the same specialties are represented to a degree, they're very strong on gynecology, pathology, and also on lymphoreticular. So the entire range of specimens is available for training. We also expect our trainees, as I said earlier, to participate in multidisciplinary team meetings, and we find this to be very beneficial to their training, where they learn really to interpret findings in context and to ensure that the pathological findings account for the imaging findings or the clinical findings. So that's a very, very essential and integral part of their training. We also provide formal teaching in the form of black box slide sessions and also formal lectures within the department. And of course, this then is supplemented by the RCPI study days and progress overseen and monitored by the designated trainers. We do have, one of the questions, is there protected time for audit, research and teaching activities? Yeah, we've got a very busy service, but we do try to make a time available, and an audit is one of the requirements. And ultimately, all of this training really is geared towards equipping the fellow to take up a consultant post when they return to their home country.
Thank you, Prof. Quinn. I'll just go to Dr. O'Sullivan. Are there opportunities for simulation training, research, or audit work?
Absolutely. So part of our normal curriculum involves simulation in gynecological surgery and in obstetric emergencies. So each fellow will be part of the simulation offering, or will be invited to that, depending obviously on the specialty. So gynecological surgery won't apply to maternal medicine, but simulation is available across all of the specialties. Audit and research is an integral part of all of our curricula and our services. So very much, as Cecily said, the audit is mandatory, and the opportunities for research are plentiful. And as I say, I suppose one of the things that we're really working towards, as the other clinical leads have said, is leadership. So bringing home very senior levels of decision making and skills, and being able to look at setting up programs and services from scratch in units, and not just looking at the ability to do a procedure, but the ability to run and oversee a service, and quality and safety audit. Data collection is really important across all areas of obstetrics. One of our fellowships that we've kind of evolved recently is looking at data collection and perinatal epidemiology, and the collection of perinatal statistics, which are really important in overseeing and maintaining quality and safety across maternity services. So they're things that we're really interested in, sharing the knowledge and developing these skills, and that's core to what we're looking at providing and sharing.
Perfect, thank you. And finally then, Prof. Al-Nazir, what support is available to help international fellows adapt to paediatric care models in Ireland?
So, obviously, well, I mean, it is throughout the whole journey, the fellowship program, the trainee will be supported by aspects of support. If somebody is assigned to to report on certain studies, there will be senior physiologist or technician available depending on the subspecialty. But taking the whole process, definitely there is ongoing support by the mentor, and there are structured meetings with your mentor whereby all issues that arise during the program are actually ironed out. So, there is an ongoing support, and the whole idea of this program, at least in pediatrics, is obviously it's a clear supervised clinical training, and in a very comfortable learning environment.
Thank you, Prof. Nazir. And I suppose then just the final question then of this panel discussion is to Sinead Lucy. And as Director of International Training and Examinations, what is the one key takeaway from today's session you would like, the audience to remember?
Thanks, Sinead. Maybe I'll make it more than one. I might just highlight a couple of things.
Sure.
Just thank you so much to the panel. It's really important. There's a wealth of information here. So, as I said, we'll be recording the set. We've recorded the session, so please do listen back on some of the points that have been made. But I guess if having listened to the presentations and the panels, there's a couple of things. I think you should start your preparation early. So think about, do you have to achieve English language requirements? Make sure you've given yourself plenty of time to do that. Book your IELTS or your OET exam on time. So really start your preparation. And within your preparation, if there's a certain specialty you're looking at, please take some time to look at the curriculum carefully. So does it meet your training needs? Look at what the curriculum or CPI is providing. Does it meet your training needs? Is there something that you would really like to train or have exposure to that's not covered in the curriculum? Reach out to us. We'll see if it's feasible. It may or may not be. But again, that should form the cornerstone of your preparation. And if you're successful at interview, Denise from Castell gave a very good presentation, an informative presentation. Engage with Castell really early. It's so important as a trainee that you have your accommodation sorted. If you have children, that you have your schools, your creches, your childminders, all of that in place, so you're able to comfortably start your training program in July with nothing really to worry about other than your getting to the hospital and meeting your trainers. And then finally, I would strongly recommend that you reach out to alumni. So we have over 200 alumni of this program across many of our specialties in internal medicine, obstetrics and gynecology, pediatrics, histopathology, public health, occupational medicine. So again, reach out to our alumni, the team here, Adam and Paula and Anton and Sinead will be able to connect you with alumni if you don't already know any, and get a sense of what it's like to train in Ireland, to live in Ireland, and to enjoy our hospitality and our food. And that's it. Thank you.
All I think that's left for me to do is just to thank the panelists for a very informative session. The audience, to you for your time today, and also to the RCPI team for organising today's session. I'd like to just one last word to encourage everyone to go to the RCPI website and have a look at our e-brochure. So in the e-brochure, you will find all the information that you need to know about the programs, the entry criteria, supports available, etc. I think we do have a QR code here that you can scan, which will bring you directly to the e-brochure.
You might share that QR code, Anton, with the final slides, just so the participants can see it, and then we'll say goodbye to everybody. Okay, we'll circulate that QR code to everybody. Thank you to all of our panelists. Really appreciate your time, and thank you to all of our participants. Thank you for taking time out of your busy day, I'm sure. Please reach out to us if you've any queries at all, and I do hope we welcome you here at RCPI at some stage in the future. Thank you, everyone.